So, Deneen, what role do patient-reported outcomes play in your broader quality and safety initiatives at Northwestern? And if you don't mind, could you also comment on the new CMS PKA THA Pro PM mandate and its impact on transforming patient-reported outcomes from what was maybe once considered a nice to have to now really a quality reporting must have?
Thanks, Matt. Just to give you a little bit of background, I was asked about 3 years ago to work on this project, and we have been doing patient-reported outcomes for total knee and hip for about 10 years. When I started to evaluate the data, I was like, oh no, this is not going very well. We had very low conversion rates, about 20% with our current infrastructure. Realizing that CMS really upped their game on the patient-reported outcome mandate, and not that we were just required to report the measure, but we were actually had thresholds. We have to have 50% of our patients who complete the pre-surveys and then the 1-year surveys. So in order to do that, you really have to push that initial pre-survey threshold really up into the 80s, 90s%, because you're going to have that natural regression of people at 1 year that are either not going to choose to do the survey or you just can't connect. So you really have to get those high thresholds. And if you don't meet those requirements, CMS can withhold funding from you. And so when we calculated that out at the tune of almost $9 million across our health system, we surely got the attention of our executives to understand and prioritize this initiative. So with that, we did that evaluation of our current infrastructure and the limitations that the technology had. And so we really needed a frictionless, automated program that would really help us achieve our targets and our goals. And so we were able to initiate our infrastructure and really optimize gathering those requirements, and knowing too that it's not only just gathering the surveys, but it's also that significant substantial clinical gains that the patients are having from pre-surgery to post-surgery, in which ultimately, if you get them early enough, you can make that evaluation if they need surgery or not. So but that gives you a little bit of insight, just really how much pressure CMS is having on hospitals to really achieve a high rate and level of patient-reported outcome compliance.